Welcome to the annual House of Delegates of the Pennsylvania Medical Society. We are compromised this year by the emergency virtual event, which is no substitute for those personal interactions that made our House of Delegates such a memorable and effective experience. The art of medicine will always depend on interpersonal communications, such as face-to-face relationships, meetings, and interactions, and the sharing of mutual experiences. Hopefully, we will all be back in person next year. I honor the commendable response which was done by you, our members, the counties, the staff, and the officers of the Pennsylvania Medical Society, who, when called upon by this pandemic, rose to the challenge. Our efforts did indeed make a difference and are a shining example of what can be accomplished through cooperation. Remember, tough times don't last, but tough people do. I would like to acknowledge and thank some of my many colleagues with whom I have worked closely this past year. My predecessor, Dr. Larry John, for his efforts during the year in alerting us and caring for us with his initiative of physician well-being. Dr. John, a job well done during what we know is an exceedingly difficult and trying year. I support your efforts and encourage you to continue and look forward to your leadership in this area. Dr. Denai Powers, for her active contributions. You are a devoted member of the Society and your insights are vital. And the ever-present Dr. John Gallagher, for his many years of service to the Society. John, all wish you much health and happiness during your retirement. Like any great organization, the Pennsylvania Medical Society is based on ethical principles. We must be responsible for our efforts without regard to self-advantage, sectional advantage, regional advantage, but for the betterment of the profession and the patients. We must be accountable for our actions. We are not perfect, but if we do not reevaluate our past decisions, we will never learn from them and be forced to repeat them. Most of all, hand in hand with responsibility and accountability, we must be completely transparent amongst ourselves and our members. Such attributes add value to membership, and we must all actively campaign to get new members. All us members must be diligent to and continually active in the participation of bylaws and resolutions that determine the direction of the Society. The membership defines and rules the Pennsylvania Medical Society. Each and every one of us has an obligation to be proactively involved in this society and not passive and reactive. My personal initiative for this year will be to prepare for the advanced technologies that will be affecting our profession in a manner never seen before. Nanotechnology, biosensors, robotics, and especially artificial intelligence will saturate our profession and take over healthcare in the not too distant future. We must be at the table and not on the menu to determine where these technologies fit into the profession and the proper care of patients. To that end, I will be preparing lectures and interview with experts on these topics, which will be placed on our website during the year. So let us add positively to our illustrious 172-year legacy, which spans politics, wars, and plagues. Let us face the coming year together and proactively participate in our society. And remember, it will be my esteemed honor to serve you.